Hello, my name is Leah Christie and I'm a student nurse at the University of South Alabama, and today I'll be doing an indwelling catheter checkoff. So now I'm going to have her scan my room. And now I'm going to verify my patient care order form as well as the hospital policy. Then I'm going to perform hand hygiene upon entering the room, and I'm going to identify my patient using two identifiers. I'm going to be using the patient care form and the armband. So I see Jaguar Jones, date of birth August 25th, 1963, date of birth August 25th, 1963. I see that he's allergic to penicillin, which is also on the patient care order form. And then I'm going to explain the procedure to the patient, and I'm going to list the three indications of justifying using the catheter, the indwelling catheter, which would be required immobilization for surgery, trauma, or other therapies, strict urinary output monitoring as indicated by plan of care, and to assist in healing of open sacral or perineal wounds in incontinent patients. Now I'm going to provide patient privacy, and I'm going to gather all of my equipment, and I'm going to put my goggles on, and then I'm going to position my trash can, perform hand hygiene, and I'm going to raise the bed to a working height, lower the side rail, and position my patient into the dorsal recumbent position. Now I'm going to apply my clean gloves, and I'm going to be doing the perineal care. So for a male, I would have the male be in the supine position, and I would expose the area, placing a towel underneath the penis, and then I would grasp the shaft and retract any extra skin, such as if a patient was not circumcised, and then I would clean the urethral meatus in circular outward motions 3 times, and then I would rinse and dry, and with a separate washcloth, I would clean the shaft, the scrotum, and the skin folds, and then I would rinse and dry as well. Now for a female, I would place them in the dorsal recumbent position, which is what they're in, and I would expose the area, and I would clean the labia majora. So I would retract the labia, and I would clean the skin folds on both sides, going from the perineum to the rectum, and then I would rinse and dry, and then after that I would retract the labia and expose the urethral meatus as well as the vaginal orifice, and I would use separate cloths for each section, going in a downward one stroke technique. So cleaning each section with separate stuff, and then I would rinse and dry. And now I'm going to take off my clean gloves, and I'm going to open my catheter kit. So I'm going to take it out and discard of that. So I open it away from me and the sides, and then towards me. And now I'm going to don my sterile gloves. So when I don my sterile gloves, I'm going to put my fingers under the tabs, open it, and only touch the 1-inch border. And I'm going to grab and put my finger underneath. And usually my gloves would not touch the 1-inch border at all, otherwise that would be contaminating them. And then I'm going to keep my hands above my waist level to avoid contamination. So now I'm going to place my sterile drape in between the patient's legs, and I'm going to grab the edge of it, and I'm going to fold it inward of my hands, and I'm going to tuck it between the patient's legs, and then I'm going to move the tray close to the genitalia, and I'm going to prepare my cleansers and my lubricant. So I'm going to take my cleansers out and discard the wrapping, and then I'm going to take my lubricant and squirt it onto this section, and I'm going to take my a water-filled syringe, and I'm going to uncap it, and I'm going to move this so that there's no gaps, and I'm going to take the balloon port, and I'm going to stick the water syringe in there, and then I'm going to take my wrapping, and I'm going to take it off of my catheter tubing, making sure to not let it touch anything, and then I would discard. And now I'm going to lubricate the tubing, doing 1 to 2 inches for a female and 5 to 7 for a male. And then while I leave that lubricating, I'm going to cleanse. And the way I would cleanse is I would cleanse around the urethra for a female, and I would place my fingers on the labia, making sure to not close my fingers, otherwise that would be contaminating. And so I'm going to grab one swab, and I'm going to go away from me, and then discard, and then I'm going to go close to me and discard, and I'm going to go in the middle and discard. Now if it were a male, I would clean around the opening of the penis and in outward circular motions down the tip of the penis. And so now I'm going to tell my patient that I'm about to insert the catheter. So I would tell them to bear down to as if they were voiding, and then I would also tell them to take deep breaths and exhale. And if this was a male, then the patient would be perpendicular. The penis would be perpendicular when I was inserting. So now I'm going to insert my catheter, and I'm going to insert it gently, and I'm going to keep inserting until I see urine return. So then once I see urine return, I'm going to advance the catheter 1 to 2 inches for a female, or all the way to bifurcation for a male, and then I'm going to secure it. And now I'm going to inflate my balloon, and I'm going to keep pressure on the plunger the entire time. And so I inflate my balloon, and then I'm going to unscrew it while keeping my thing intact, and I'm going to set this to the side. And now I'm going to tug, and I'm going to advance slightly. After I do that, I'm going to cleanse my inner thigh so that I can put on the stat lock. So after I cleanse it, I'm going to open it up and demonstrate how to place the catlock, or the catheter in the catlock, or the stat lock. And I would do this, and then I would snap it in place, and then I would face the arrow towards the patient's belly, so I would just push it on there. And then I'm going to demonstrate how to remove it too, but I'm going to do that near the end of the procedure. Now I'm going to secure my drainage bag, and I'm going to make sure that I hang it below bladder level and on the bed frame and not the bed rail. So I'm going to squeeze down so I don't break sterility. And then now I'm going to grab my specimen collection container, and if the catheter was just put in, then I would take the specimen collection from the bag. So I would unscrew and place my cap upward, and then I have a towel and a graduated cylinder underneath just in case of any spillage. And then I'm going to go down, and I'm going to remove the tubing from the port, and then I'm going to make sure that I don't touch the inside of the container, and I'm going to put the urine in the container, and then once it's filled, I'm going to place this back in, and I'm going to recap and label. And then for if the catheter was put in hours ago or days ago, I would again uncap and leave the cap open, and then I would clamp my tubing, and then I would take a alcohol swab and clean the blue port on the tubing and let it dry and make sure that nothing else touches it. And then I'm going to grab my empty syringe, and I'm going to put it on there, and I'm going to retract urine into the syringe, and And then once I do so, I can take my container and I'm going to make sure to not touch the syringe to the outside of the container, and I'm going to put the urine in there. And then I can discard of that and recap and label. And I'm going to set this aside. So now I'm going to move my supplies out of the way, and I'm going to doff my sterile gloves using glove to glove and skin to skin technique. And now I'm going to lower the bed to the lowest position and raise the side rail, and then position the patient comfortably, making sure that the call light is in reach as well as any comfort equipment is in reach. And then I would perform hand hygiene, and I would document the size of the catheter and then the amount, color, and consistency of the urine. And then I would also document the patient's reaction to the procedure, the specimen collection if indicated, and the daily care for the catheter with soap and water, and as well as after incompetence of stool. And then I would also I would remove the catheter as soon as medically indicated. And now I'm going to discontinue my catheter. So I'm going to, earlier I would have unclamped my tubing right after I filled the urine. So that would have been unclamped. And then I'm going to perform hand hygiene and apply my my clean gloves. And then after I do that, I'm going to empty the drainage bag, and I would use the port that I used for the specimen collection. It would go into the graduated cylinder, and that's how I would measure it. And then I'm going to remove the catheter from the stat lock. So you just pinch this and then it comes right out. And then I would take my plunger and I'm going to kind of pump it to loosen it up. And then I'm going to put it at 0.5 milliliters. And I'm going to attach it to my balloon port and let gravity fill it up. And then once I do that, I'm going to remove it, and I'm going to take the catheter out, and I'm going to discard of the catheter in the drainage bag, and then I'm going to provide perineal care, and then I'm going to take off my gloves, and I'm going to wash my hands and document the amount, color, consistency, and odor of the urine, the intactness of the tip of the catheter, the amount of water that was removed from the balloon, as well as how the patient tolerated the procedure. And I would teach the signs of a UTI, which is frequency, urgency, and dysuria. And then I would plan to come back and assess the patient after 4 to 6 hours to see if the patient has voided, and if they have not voided, then I would palpate the bladder and I would obtain a bladder scan. Thank you.